I'm pleased to be joined today by Dr. Jose Romero, who will be the acting Secretary of Health, and he will give the report today. And then, as you know, Dr. Nate Smith will be taking on new responsibilities, so he'll be here tomorrow, which will probably be his last day for a daily update. But glad to have Dr. Romero here, and he will carry on very ably. I'm also joined by Troy Wells, the CEO of the Baptist Health Systems, and I've asked him to talk a little bit later about his experience with testing in his hospitals, as well as on the capacity issue. And so I think that will be interesting and informative as well. And as Troy comes, let me just say Baptist Health System has really been a great partner in making sure we have adequate hospital space, but also in our testing as well. So Troy, thank you.
Thank you, Governor. I appreciate the opportunity to be back with you today, and good afternoon, everybody. I want to start off my remarks today just by pausing and recognizing and thanking our healthcare workers across the state of Arkansas. There are 11,000 associates at Baptist Health across our state, and I'm always impressed and so proud to serve with them each and every day, taking care of our Kansans. But for all of our healthcare workers, whether it be in nursing homes or clinics or hospitals across Arkansas, I want to say thank you once again for all the work that you're doing. A couple of things I want to talk about today. First, I want to just briefly talk about ICU capacity. That is a pretty common question that we get asked a lot, so I thought I'd share some information there. But before I do that, I just want to give you a little context. Baptist Health it has 11 hospitals throughout the state of Arkansas. We staff about 1,500 acute care beds across our state in multiple communities. But today I want to talk about ICU beds. We've got about 200 ICU beds in our major facilities across Arkansas. And so I want to just share some information with you about that to give you a little context about where we've been and where we are today. So I look back about 1 month ago, which happened to be the highest ICU census that we've had throughout the pandemic at Baptist Health. So that was June the 18th. We had 181 ICU patients on June the 18th out of 200 beds. Of those ICU patients, we had 16 COVID positives. All right, we had a total of 42 inpatients that were COVID positive, but 16 of those were ICU patients. So you go a month later today, we have an ICU census of 161. That's actually down from where it was a month ago by 20 patients. But we have 32 COVID positive patients in our ICU. So that number has doubled. We've got 19 patients on ventilators, which is the most we've had so far. We still have plenty of ventilator capacity at Baptist Health, and also I understand that's the case across the state. Today we have a total of 89 COVID-19 positive inpatients in all of our hospitals, so that's also about double, just slightly more than double from what it was 1 month ago. So just a couple of, that's a lot of numbers I threw out at you, but I want to just give you some key takeaways. The COVID-19 hospital census has doubled in a month, but we still have ICU capacity. All of the large regional hospitals across the state that have ICU beds are typically running between 80 and 95% capacity on any given day. That was before COVID ever happened, and so that's something that hospitals have to actively manage day to day, and we're really good at doing that, and we're doing that now. And you see just from our numbers, you have swings of 20 to 30 ICU patients in a given day in the larger ICUs. There are adequate beds in the state of Arkansas today. Each hospital has a surge plan that they stand ready to implement if the need arises. We are fortunate in Arkansas in that we've had a long lead time to prepare for a surge in cases, and we've got plans that we can execute as needed, and we can work together as a hospital community across the state to do that. I also just want to say thank you to the governor and to the Arkansas CARES Committee for providing some financial support for hospitals across the state. That really has helped us to prepare even better now for these additional cases that we're seeing. One brief mention about lab testing. That's also a hot topic these days. At Baptist Health, we've experienced some of the same delays in receiving results from the commercial laboratories. We're limited internally on how many tests we can do per day because we can't receive the reagents that we need to run those tests. So we have multiple machines, very few reagent that we receive each week. So we rely heavily on the commercial labs. And we have seen delays up to 5 and 6 days for some of those patients that we're trying to receive results for, and that does create some challenges, particularly around surgical patients that need to have that test prior to surgery. One last thing I'll mention before I yield, and that is Baptist Health Center for Clinical Research. We are beginning a phase 3 clinical trial for a COVID-19 vaccine. And that's great news because Arkansans will be helping to develop a vaccine for COVID-19. Guidelines for who can participate in that clinical trial: you're eligible to participate if you're over 65 years of age, or if you're between 18 and 65 and you work outside the home. So that's really important. If you've been working from home for the past 90, 100 days, you may not be a good candidate for this trial. But if you've been going to work and in the public, you're between 18 and 65, you might qualify for this trial. So anybody that's interested in learning more or trying to find out if they're eligible to participate, there's a website. It's arkansascovidvaccine.com, arkansascovidvaccine.com. So I would encourage you, if you're interested and you think you might be eligible, to participate in that clinical trial. With that, thank you, Governor, again for having me.
Thank you, Troy.